Hi, this is Haley Boyko, and I'm going to be presenting my critical assignment for this class, Care and Prevention of Athletic Injury. So, this is my title slide. It's cute. And I'm going to switch sides. So this is my chosen sport, which is cross country. And I chose this sport because I have personal experience with it. I was in cross country in high school, and it was definitely my favorite sport to be a part of because it was really challenging and I learned a lot about myself. Okay, so factors that may cause injury. So there's not many studies linked to age and running injuries, but what I did find is that lower age, so younger people, are more protected against injury involving overuse of the muscles. So that makes sense. Gender, women are way more susceptible to developing an injury. So I think they're like 3 times as likely to develop a running injury because they have weaker hamstring muscles and more fragile hip flexors, whereas men have strong hamstring muscles that support their knees and hips and everything. So with the environment, a bumpy or like irregular surface is detrimental because one, like wrong pivot can cause injury. Also, hard surfaces could be bad too because slamming too hard down will create an injury in the long run. Okay, so for my first injury is the iliotibial band syndrome. And this is the most common cause of lateral knee pain in runners, and it's an overuse injury of the connective tissues on the lateral part of the thigh and knee. And it swells the tendon around the iliotibial band. So the mechanisms of injury for this can be caused by running on a slope for long periods of time, differences in the leg lengths of the runner, poor foot structure, excessive shoe breakdown, so not switching out the shoes regularly, training intensity errors, muscle imbalances, or poor running mechanisms. So the anatomy is the IT band is a thick band tissue that originates at the iliac crest, and then this goes through the outside part of the thigh and crosses the knee to attach into the tibia. And then there's a bursa that allows for smooth movement of the IT band, and then when ITBS happens, this bursa is inflamed, it's swollen. So, and then leaving this untreated can decrease the range of motion of the knee, obviously. And then the test for ITBS is called the Ober's test, and this is where the patient lies down with the unaffected side down and the unaffected hip and knee at a 90-degree angle. And then if the IT band is tight, the patient will have difficulty adducting the leg beyond the midline and may experience pain at the lateral knee. So that is the test to check if a patient has ITBS. And then the exercises for ITBS, the 2 preventative exercises are assisted single leg squat, which would be recommended 4 sets of 10 each leg 3 times a week, and the progression is no assistance, so not using like a platform to tap on your way down, you're just using your full body weight. And then step ups, which it would just be using like a small platform or chair, and you step up with one leg, tap with the other, and then come down and switch legs. And both these exercises really strengthen the leg muscles that in turn stabilize the IT band. And the progression for this is to add weight in your hands when you step up. Rehab exercises include the hip thrust and then the side leg raise. The hip thrust 4 sets of 12 5 times a week, and the progression is to do it single leg, so the single leg works a lot harder. And then the side leg raise is 4 sets of 10 each leg 5 times a week. And the progression would be to add weight on the side of your leg. And then I posted my YouTube link there with me showing 1 preventative and 1 rehabilitative exercise. So yeah, you can click the link in slideshow mode, or you have to copy and paste it into your browser. I know we had trouble with the links last time, but I think these ones should work. Okay, and the next injury is the ACL tear, and this is overstretching or tearing of the ACL ligament in the knee, and it could be complete or partial tear. As you can see in this picture, there's a normal ACL and then an injured ACL. You can see the big difference between that tendon right there. It is, yeah, it's torn and it's not good. So the mechanisms of injury. So this can be caused by suddenly slowing down and changing direction while running. So that's what I was talking about with like the uneven terrain, where it's easy to pivot incorrectly, and then that really affects the knee. And this could also be caused by stopping suddenly too while running. And then back to the factors of like gender, women are more likely to tear their ACL because they are usually quad dominant, whereas a male's hamstring strength protects his shin bone from moving too far forward, which causes the tear. So that's what I talked about in the beginning, that men have naturally strong hamstrings, and that is to their benefit when it comes to these injuries. So anatomy. The ACL is one of the 4 static stabilizer ligaments of the knee joint, and the injury in this is caused by overuse or misuse of the knee joint. And then assessment-wise, the anterior drawer test, which is an orthopedic exam of the knee, and the Lachman's test, which is a pivot test, have been proven to be more accurate than an MRI, which is really interesting. And the exercises for this is the preventative exercises are squats, 4 sets of 15, 3 times a week. Progression is to add weight. Walking lunges, 4 sets of 20, 3 times a week. Progression, add weight. Both really good compound movements for all the leg muscles to strengthen them, thus stabilizing the knee. Rehab exercises, calf raises, 4 sets of 20, 5 times a week. Progression is to do a single leg. And then seated knee flexion and extension, 4 sets of 20, 5 times a week. And progression is to do it standing to provide a little bit more balance. So, yes. And then YouTube link down there. Piriformis syndrome is the 3rd injury. And this is a condition in which the piriformis muscle, located in the buttocks, spasms and causes pain. So this may radiate down the runner's thigh to the back of the knee. The mechanisms of injury, this can be caused by overuse and strains from running, inflammation, trauma, and built-up scar formation. Anatomy. So the piriformis muscle is flat and located near the top of the hip joint in the buttocks, like I said. And it's caused when the muscle compresses with the sciatic nerve. So the sciatic nerve goes through the piriformis muscle and all the way down into the feet. So the spasms of the piriformis create nerve compression of the sciatic nerve. So this is commonly mistaken for sciatica. So it really needs to be assessed to see which is which. The assessment, like I was saying, is the compression. The compression of the sciatic nerve is tested by clinical history and orthopedic assessments, and the piriformis is determined to be the cause of the patient's sciatica. So they need to be linked together for it to be piriformis syndrome and not just sciatica. All right, and the exercises for this, preventative exercises, body weight jump squats, 4 sets of 12, 3 times a week. Progression, add weight. Lateral banded walk, so band above the knee and then just squat down and walk side to side. 4 sets of 23 times a week. Progression would be a stronger resistance band, so like a heavy resistance band rather than a medium resistance band. Rehab exercises are 2 stretches, seated piriformis stretch, so 3 sets of 30-second hold 5 times a week. Progression, hold longer. Seated hamstring stretch, 3 sets of 30-second hold 5 times a week, and progression is to hold longer as well. And then there's the YouTube link for that. And then this is my reference page. So thank you so much for listening.